Hey everyone, Dr. Michael Richman, double board certified cardiothoracic surgeon. So, for more than 80 years, men have been told that testosterone helps prostate cancer grow. But over the past 20 years, a very different picture has emerged. So, a little about the biology. All prostate cells, whether healthy or cancerous, contain what's called androgen receptors, kind of like parking spots. And these are the molecular switches that initiate testosterone's action inside cells. So when the testosterone binds to these receptors, like a car parking in a spot, it helps the prostate grow and function normally. And this belief rested largely on the work of the Nobel Prize winning laureate Charles Huggins in the 1940s. And he found that prostate cancer shrank when testosterone levels were lowered and accelerated when testosterone was added via injections. So, lowering testosterone levels, known as androgen deprivation therapy, became the standard treatment for advanced prostate cancer, and it still is. So, removing testosterone often shrinks tumors, slows disease progression, and improves survival. But recent medical studies now show that testosterone treatment is safe in certain situations. In multiple high quality studies, testosterone therapy in men with low testosterone levels does not increase the risk of prostate cancer compared to men who didn't receive the treatment. In a landmark paper by Basin et al. And JAMA Network Open in 2023 published a study titled Prostate Safety Events During Testosterone Replacement Therapy in Men with Hypogonadism, a randomized clinical trial, which is the gold standard. And in this study, the placebo-controlled double-blinded study enrolled 5,200 plus men aged 45 to 80 from 316 U.S. trial sites who had two testosterone concentrations less than 300 nanograms per deciliter, and found that a middle-aged and older men population with low testosterone, carefully evaluated to exclude those at high risk of prostate cancer, the incidence of high grade or any prostate cancer or any prostate events were low and did not differ significantly between testosterone and placebo-treated men. And this is huge. Now, also new long-term research suggests that even men whose testosterone levels are partially restored and monitored by doctors may actually have low cancer rates. None of this, though, however, means that testosterone replacement therapy for men with low testosterone levels is completely without risk. So men starting treatment should get proper medical checks by a urologist, probably, have their prostate monitored regularly, and make decisions after talking things through with their doctor. But the doctor needs to be competent. But the science has changed. The old belief that testosterone therapy increases prostate cancer or makes it worse is no longer backed up by modern research from randomized controlled trials. Once again, the gold standard. So for men who genuinely have low testosterone, this change is important because it can remove unnecessary obstacles to getting care and gives them more safe, science-backed treatment options, which helps improve overall men's health. Okay, so with that, hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or consultation, you can go to my website at www.paladinmds.com and have a good day.